You feel it, that weird pain down there that won't go away. You've Googled everything, prostate, infections, maybe even cancer, but nothing adds up and no one's giving you real answers. What if I told you millions of men are feeling this exact same thing and most are misdiagnosed or ignored? Today we are talking about something that is very, very important because it's affecting millions of men suffering silently from it. It's called prostatitis. Before we dive in, here's what you'll learn in this video. Number one, the 4 different types of prostatitis and why doctors often misdiagnose them. Then the wide range of unexpected symptoms beyond just urinary issues and effective natural treatment options backed by recent research. This isn't just medical talk. This is personal. I've seen countless men struggle with prostate issues for months, enduring multiple doctor appointments and taking medications that provided little relief. But the most frustrating part, they never received actual answers about what was causing their problems or how to truly solve them. If you are dealing with unexplained pain, bathroom problems, or even bedroom issues that no one seems to take seriously, this video is specifically for you. But first, what is prostatitis? So let's break this down very simply. Your prostate is this walnut-sized gland right below your bladder, and its job is to help make the fluid that comes out when you ejaculate. When this gland gets inflamed or irritated, it's called prostatitis. But here's where doctors often miss it. There are actually 4 different types, but most treat it like it's just one thing. And contrary to what you might think, this affects guys of all ages, not just older men. It's not an old man's disease. For many, it can stick around for months or even years, if not treated right away. So let's break down the 4 types super simply. Type 1, sudden bacterial prostatitis, also known as acute bacterial prostatitis. This hits you like a truck. You have fever, chills, intense pain when you pee, and if you experience this, I advise you get medical help immediately because it's serious. Type 2, long-lasting bacterial prostatitis, also known as chronic bacterial prostatitis. It's the same bacteria, but it sticks around, and you might get infections that come and go for months. The bacteria forms a sticky barrier to stay hidden, making them very hard to kill completely. Type 3, chronic pain syndrome, is the most common type and it accounts for 90% of cases, and it's not caused by bacteria. 9 out of 10 men have prostatitis of this kind. Type 4, silent inflammation, also known as inflammatory prostatitis. You don't feel symptoms with this one, but inflammation shows up on tests and is often discovered accidentally during other procedures. The symptoms of prostatitis can be all over the place, which is why so many men get misdiagnosed. Symptoms include bathroom issues like burning when you pee, feeling like you need to go constantly, waking up multiple times at night. Sometimes you see your urine looking cloudy, or you also have trouble starting your stream. There is slow flow or dribbling. Sometimes you even might see blood stains in your urine. Then there's also pain in places you wouldn't expect. You have lower belly pain, lower back pain, you have pain in your testicles, you have pain in your penis, pain during or after ejaculation, and even discomfort during bowel movements. And then there are other symptoms that you might not connect. We have erectile problems, feeling exhausted all the time. There's depression, there's anxiety from dealing with constant discomfort. You also might experience brain fog or trouble focusing, muscle aches like you have the flu, and sometimes many men experience flare-ups where everything gets worse for some days and then they kind of fade. Now, why does this happen? Different types have different causes, but here are the main ones. Number 1, for acute bacterial prostatitis, the cause is a sudden bacterial infection, and the common culprits are E. coli, Klebsiella, Proteus, and Staphylococcus bacteria. The main triggers are urinary tract infections spreading to the prostate, the use of a catheter cancer or if you've recently had a prostate biopsy, and also sexually transmitted infections like gonorrhea or chlamydia. For chronic bacterial prostatitis, it is caused by a recurring low-grade bacterial infection. And why does this happen? It's because hidden bacteria survive in the prostate because they form a protective barrier around themselves. Also, incomplete treatment and enlarged prostate trapping bacteria can lead to this. For chronic pelvic pain syndrome, it's caused by no infection, but it's a mix of pelvic nerve dysfunction, autoimmune reactions where your body's immune system attacks your prostate cells, causing inflammation. There's also the effect of chronic stress and anxiety worsening inflammation, and pelvic floor muscle spasms, which is common with desk workers or drivers. For the asymptomatic or silent prostatitis, triggers involve autoimmune activities and environmental toxins. So who is at risk of coming down with prostatitis? Number one, if you are between the age of 30 and 50 years, you eat a lot of spicy foods, alcohol, caffeine, you sit for long hours, you have chronic stress, you have a medical history of urinary tract infections or sexually transmitted infections. So these are the category of men that are at risk. Now, when you are being diagnosed at the hospital, most times they just do a quick test, and when they see nothing unusual, they either dismiss you or they throw antibiotics at you that may not work. The standard test that they run can miss up to 80% of prostate infection. The proper test involves checking your urine before and after massaging your prostate. It's not pleasant, but it's very necessary, and very few doctors take the time to do this. So if you've been struggling with pain for a while, you need someone who understands this condition properly. Now, what are the conventional options you'll be presented to when you get to the hospital? For bacterial types, yes, antibiotics can help, but you need a stronger ones, and you need to take it for longer because the bacteria can hide in protective shields called biofilms, and that makes them very difficult to reach. For the most common type, which is the chronic pelvic pain syndrome, the best approach combines multiple strategies. You could be advised on pelvic floor physical therapy. This is very huge and it's often overlooked. Also, alpha blockers are given to relax tight muscles, anti-inflammatory medications, nerve pain medications when needed. Stress management techniques are also advised because your brain and your body are connected. To the natural options that are backed by research, first of all, you have the natural anti-inflammatories, something like quercetin in combination with bee propolis. Both have been shown to significantly reduce these symptoms. Also, we have pollen extract, which has been successfully used in Europe to combat issue. Now, a brand new 2024 study found men with prostatitis had very different gut bacteria, and fixing that helps symptoms. So, taking specific probiotics might help prevent recurring infections. What are the lifestyle changes you need to make? Number one, eat anti-inflammatory foods. Lots of leafy greens, berries, whole grains. Cut back on the things that irritate the prostate, like alcohol, caffeine, and spicy foods, and even processed foods. Studies have linked spicy foods to a worsening of chronic pelvic pain syndrome. Exercise, but avoid high-impact activities like bike riding. Go for gentle movement. Stay hydrated. Drink lots of water, more than you think you need. Manage stress, maybe like breath walks. Whatever can help keep you calm. Prioritize sleep because your body heals best when you are rested. One study found men who made at least 3 of these changes saw their symptoms drop by half. That is huge. So if you are dealing with prostatitis or symptoms that no one seems to have answers for, please hear this. You are not imagining it. You are not broken, and you are definitely not alone. The pain is real, the frustration is real, and so is the solution. You don't have to keep managing your symptoms. You can solve the problem. And that's exactly what I do in my prostate health recovery blueprint session. In less than 60 minutes, we'll uncover the real root cause of your prostate issues and build a step-by-step plan to help reverse it naturally and effectively. So you walk away with clarity, direction, and a strategy that actually works. And you won't be doing it alone, because for the next 2 full weeks, there's going to be follow-up support so that you are never left guessing about what to do next. You are ready to take back control of your prostate health. Just click the link in the description to book your session. Your comeback starts now. Thank you for watching.